Hi, I'm joined today by my colleague, Dr. Carlos Protzel. He's a licensed social worker and psychologist, and he's been working in the field of psychotherapy for 22 years. So he's worked in a wide range of treatment settings, including prisons, addiction rehab facilities, and he's in private practice. Most recently, his focus has been helping adult men work through addiction issues and also with mood disorders. Thank you for joining me. I'm so glad to be talking.
Thank you for having me, Laura.
Yeah, I'm so glad to be talking to you about men in therapy. I've worked with a lot of men in therapy, and I find a few key issues going on with them. They usually don't find their way to me by themselves. They're usually referred by oftentimes a woman in their life, whether it's a wife, a girlfriend, a mother. And then once they do get into therapy, they'll share a very disturbing situation with me, and they say, I've never told anybody that this has happened to me. And it never ceases to amaze me that they've been suffering in silence, and they often put on this image of strength. Can you speak to that?
Sure. I mean, this is a very important issue that's come up. You know, in my experience, I'm always amazed at how much work it is involved in just getting the person to make a call, to send an email, to even walk through my front door for the first session. And there's so much support from family, friends, partners, spouses. So there's a lot of work that happens behind the scenes to actually get a man to take that next step and actually get into treatment. And when they do, they have a safe container. They've got the unconditional acceptance and the trust after some time is built in therapy to actually start to dive into these issues that they've held on for 1 year, 10 years, 20, 30, 40 years. You know, it's amazing how long a person can compartmentalize and push away deep, dark secrets. But when they have an opportunity to talk about it, it is transformative because there's so much energy that's spent day by day to kind of maintain the secrets and to push away a lot of the dysphoria that they have from the past.
So you've experienced this as well.
Yeah, absolutely.
This is a common theme.
You're not the only one. This is pretty common for men in therapy.